We have with us Dr. Keiki Mehta, one of the foremost ophthalmologists, and needs no introduction, I'm sure, in the general audience as well as in the ophthalmic community. So please put your hands together, Dr. Keiki Mehta, so if you can please join me. So there's a ladder here. Just to give you a quick word, Dr. Keiki Mehta is, so please have a seat, is the medical director in chief of the Mehta International Eye Hospital, and he can be actually termed as the father of the Indian phacoemulsification because he's been around right from the commencement of intraocular implants, radial keratotomy, phacoemulsification cataract surgery. He has won at least, I mean, you can go out of count here, but 11 gold medals from India, and internationally so many awards. Some of them are Lifetime Achievements Award given to him by the West German Chemtech Foundation. He's one of the few who's the only Indian to be elected to the Legion of Honor of the Institute in Barcelona, Spain. And as you all know, he has been awarded the Padma Shri Award by the Government of India on the 26th of January 2008. So please give him a big round of applause. On refractive errors. You all know myopia, which is nearsightedness, farsightedness, hyperopia, and presbyopia are the common errors of refraction. But in this day to age where glasses and contact lenses are becoming obsolete because of what you have all heard as LASIK surgery or laser in situ keratomyusis, can all patients with myopia and hyperopia undergo LASIK?
Well, first of all, thank you for the introduction. It really wasn't necessary. And I'd like to thank the Santa Cruz Medical Association very much for having me, and even more so for placing me before lunch. I thought after lunch there was only going to be him and me and no one else.
Sorry about that, but I'm glad we did it.
LASIK, as you are well aware, is now becoming very popular. I mean, you read about it every day. Sometimes you even receive SMSs about it. It's becoming an extremely popular item for an obvious reason that it enables a person to be without glasses, and most important of all, it increases his personal self-esteem and in many ways makes him more employable, because if you have a high bar, really they will not, a number of companies will no longer employ you. So I mean, it does make a difference. But going back to your question, are all high myopes can be taken for, or myopes can be taken for doing LASIK? I'm going to digress for a few seconds, because I mean, though all of you know about it, I think it's time we establish the ground rules so you know what we are talking about. LASIK essentially is nothing much more than laser under a flap. Forget about what it stands for, inside to keratomycosis, etc. But what we are essentially doing here is just changing the shape of the cornea under a flap. Now, to do that, you require a minimum amount of base tissue which is required. Let's see if you can move on. Base tissue, essentially, imagine a cornea. Cornea has 5 layers, average thickness 550 microns. Just stay with me, I'll take the rounding circles. You have to leave minimum 250 as the minimum amount left behind. You can't play with that. You play with that, you enable a protrusion. We'll talk about that a little later in the complications. When you remove a flap, whether you remove it with a blade or you remove it with a laser, you have a thickness removal of at least 100 to 110 microns to 130 microns, which only leaves you the intermediate zone to play around. An average laser ablates or removes 13 microns of tissue per diopter. If you got, say, minus 10 to be done, it ablates 130 microns. If you have to leave 250 behind, and you add it on, comes to 450, you do a 100 flap, unless you have a cornea which is 550 microns, you can't do it. So you come back to the question again. Can all myopes have LASIK? Yes, provided they have enough thickness of material. That's the basic requirement. Second most important requirement is provided the eye is fit in every way, has no dryness, because dryness affects subsequently on your LASIK, has no pathology as you talk about, and most important of all, has no other associated sign which may lead to further loss. And a rider which is added on has a stable myopia over a period of at least 9 months to a year. That means the number should not have increased or shot up. Going down the line again, what is the youngest age? Because then obvious inferences. Can you do it at an early age? Yes, you can. What is the earliest age you can do? Really, there is no age limit defined. Normally, we take it as 18. The best time to do a myopia in a little child or an adult is when he finishes school, goes into college. Because by that time, a lot of the heavy studies are gone. Unless he is going to go in for medical, in which case, considering that so many of us are wearing glasses, it's obviously that what is pushed.
So we've also heard about what you just described as bladeless versus blade LASIK. So I think most of them are a little aware of what is femto. So if you can just tell them in short, what are the advantages, if any, between femto and traditional LASIK?
What are the risks of LASIK? Let's reverse it again. Sorry, I have to leave with you because I like to go back to what we talk about before we talk of what is the result. The risks of LASIK only lie with two things. The flap. You make a bad flap, cut a flap, break it into bits, chew it up, fenestrate it, literally cut it into little slices, is the problem which occurs. And all these complications can occur with the help of a microkeratome which cuts. Original microkeratomes cut horizontally, with the result that even a hair which got in would block the microkeratome, leading to a half cut. Or if your luck was bad, you had a hole left in it. With these sort of problems, naturally the obvious answer was to use a technique whereby we could guarantee that yes, you will get a perfect flap, irrespective of what will happen. So then came about utilizing a laser to make a flap. In other words, a femtosecond laser. A femtosecond laser has two big advantages. It gives you a flap which is pretty nice and thin, and it gives you a flap which is reproducible. And worst case scenario, if the thing stops working halfway, you can still continue it and have a good flap, which you can't do with a cutting, what we call as microkeratome based laser. So femto is the way of the future. Certainly it is there, it works great. Femto also has the advantage of a thinner flap. The very thin flap has a disadvantage, sometimes it doesn't break. Femto has one more disadvantage, that it needs a good hand behind it. You know, it's not only a machine-based surgery, it's also the surgeon at the bottom of the line who is important, because if he lifts the flap and if he does not lift it carefully, he can tear the flap. So he goes back into the same problems which he was trying to prevent. So at present, I would certainly say femto is the way to go. It is the future of LASIK surgery, and though you can, there are methods by which you can have flaps which really don't create a trouble. One of them is a Carriazo microkeratome, which, you know, like a shaving blade, indurates and cuts where there is so much less. Yes, femto is a good way to go.
Right.